Hey, good afternoon, everybody. My name is Mark Miley. I'm from Brown & Brown. This is Pat Nichols. We're here to talk to you about navigating wellness and where your broker would fit in. A couple things. Wellness, as we heard earlier, is an ever-changing world right now. It's getting more and more. You're probably seeing it at your employment or at your agency. It's coming up more and more often. The key, though, like Dr. John said earlier, it's not about just putting a plan in place, etc., but it's also giving the employees the education, teaching them about consumerism, giving them multiple options regarding wellness, and also health plans. So Pat and I are going to bring that message to you today on how wellness works with your health plans and how it can affect your bottom line and healthier employers, healthy company. So for today, we're just going to ask that you think of wellness as the overall well-being of your employees, which I think we do anyway, but think of healthy employees as both physically and mentally.
So does anybody know what this number represents? I know it's just kind of a random number up there. So as we were thinking about this, what we did was we looked at over the course of 7 days, if I were to sleep for 6 hours and I worked 40 hours a week, how much of my time is actually spent at my employer? And it was when this number popped up, 31.7% of your time, that includes weekends, is spent at your employer. So it's something we really wanted to kind of put out there, so when you're really thinking about it.
So it feels like we're our numbers much higher. At least this time of year. I don't know.
Maybe I sleep more.
Well, and that's the thing, is it's really, when you're looking at it from an employer's perspective, you really can have a direct impact on your employees. I mean, a third of their time is spent with you. So that's why we wanted to kind of start with that.
Powerful number.
Yeah.
So happy, healthy employees, more productive employees, right? I mean, how can an employer, if you can answer all these questions, reduce absenteeism, presenteeism, increase the employee morale, and reduce healthcare costs? Perfect model, right?
So, and also to what Dr. John had stated earlier, it's not necessarily if we have somebody who is, they're eating broccoli, all of a sudden they're going to be more productive. That's not what we wanted to get across, but when people enjoy going to work, they like going to work, they feel better, that comes into the overall health and wellness aspect, and that's what we wanted to get across. Again, not, broccoli, I'm happy to come to work. It's more or less, why do I enjoy coming to work? I'm happier, mentally, physically, healthier.
Yeah, if it was broccoli, it probably wouldn't come out. So in the past, wellness initiatives mainly focused on weight, exercise, and diet, and for good reason. This is back 1988. I don't know if any of you guys seen any of these slides. This is the obesity amongst adults, and obviously it was very big thing back then. Less than 10% in the light blue, all the way down to gold and greater than 25%, and that's an average man, a person of 5'4". And this is the study of what's happened over the years. 92, 96, 98, 2001, 2014. So you can see the challenges, healthcare cost, employees working, as far as not the obesity side, but the claims, etc., that can come with that. So at the present time, the initiatives have shifted to overall well-being. Not only physical anymore. It's not just about the diet and exercise, but also the mental. The mental side of things also, with visits and prescription drugs, etc., on the mental side, that's also increasing costs as well. So we wanted to focus on the physical and mental side of the employee.
Yeah, and when you look at overall mental wellness, if you look at any claims utilization reports, you're seeing a huge increase probably in anti-anxiety, anti-depression, and the costs associated with those are not low. So again, looking at years past where it's broccoli, exercise, now it's what else is coming into play? Mental wellness, mental, happy, healthy employees, what can we do? It really has shifted the last few years, and I think it's going to continue to shift.
So with healthcare costs, those of you probably just went through your medical renewal to January 1st, or you got one throughout the year. As you can see, the biggest cost of the increases, whether you're under 100 employees or over 100 employees, the biggest things, the RX costs, the stress on the employees' faces when you maybe rolled out a high deductible health plan. If you were in that last meeting, they were talking about high deductible health plans and, you know, I gotta hit this deductible before my copay kicks in on the drugs. And I'm taking this major drug, prescription drug. So now they start thinking, okay, now I gotta pay a portion of the premium, I gotta hit that deductible, and the additional costs involved with that, so that's a challenge. RX costs, they've gone up over 12 to 15% a year. More importantly, the specialty drugs have had the biggest impact. I just read something the other day. The specialty drugs, up to 2 years ago, the inventory was about $40 billion. By 2020, they expect it to be around $400 billion. How is that going to affect all of us? Obviously, the rates are just going to keep going higher and higher. Medical costs also have increased double digits. I think the Excellus trend this year, you know, most of the folks are on Excellus, but it's roughly around 9.7, 10%. And then it's based on your claims if you're over 100. Technology, good versus bad. Technology is so much better now. It's fantastic. If you had to get a stent put in, you go in there, the next year, I'm probably out the next day, you're probably back to work in 3 days. Fantastic, good recovery, etc. The problem is with technology, also is major more expenses. So technology, especially drugs, have really been driving the trends up on all the carriers across the country, and costs are just going to continue to rise. It's getting better, the drugs are getting better, the technology is getting better, but the cost is a cost to it. How are we doing with that? So the biggest thing though, we talked about consumerism earlier, giving the employee a little bit more control, giving them options of, hey, how can I take a little bit more control of my health care? And one of them is, there's a lot of pricing tools out there. I know Pat did a lot of homework on some of this, so I'll take this slide.
Yeah, so one of the things we wanted to give you some takeaways, some things that you could take back to your employees. And in looking at it, consumerism is really starting to drive health insurance as a whole. Most companies either have or will be implementing some type of high deductible plan. And typically when that rolls out, usually one of the first pain points, as we touched on before, was prescription costs. I have a prescription, it costs $7,000 or some whatever number it may be, just for argument's sake. My copay before was $35. Now you're telling me I've got to pay the first $2,600 plus blah, 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 blah. The employee is then instantly, that feeling of I'm happy, goes down to what do I do? How can I afford this? Is it cheaper for me, and this actually has come up from employees, is it cheaper for me to leave work and not work so I can actually get my prescription? Or I'm stressing out each and every month, where am I going to come up with $2,000, $3,000, $4,000? So again, it's not a perfect solution, but there's a lot of things out there that are free resources to employees. And actually what I did and where this slide came from is, in order to talk about consumerism, you need to be a consumer yourself. I actually drove to 6 different pharmacies and said to the pharmacies, what type of plans do you have in-house that doesn't involve insurance? And what can you tell me? Do you know any type of secret cure? I figure, why not go directly to the pharmacies? And the results were actually quite surprising. So the first thing is, you can see, you hear Walmart, Walgreens, Target, they all have their $4 generics. Actually, if you walk up to Walmart, there's a sheet you can pull right out that it's there. It's that easy. If you look at Rite Aid, Rite Aid has their own program, $9.99 for generics. What was interesting about Rite Aid is, talk about access to information. When I went and talked to them about this, they said, well, we don't have anything on hand. But here's our entire price list. I said, oh, okay, that's fantastic. Now I can actually see what these cost. But all the employee would have to do is simply ask. Another thing that we've seen very, it's increasing is diabetes. The cost of diabetic medicine and diabetic supplies is high. Anyone who has it or knows somebody who has it, especially type 1 versus type 2, the costs are significant. Price Chopper, through their program, actually has free diabetic drugs, free test strips, and a free meter, outside of insurance. So in doing this, it was kind of one of those sparking moments, whereas we can encourage employees to do the same thing. It took about an hour and a half to drive to all the pharmacies, but the information that was there was amazing. Another tool, some of you may know this, may have this site, may not. It's called goodrx.com. And simply what this does is this is a website that you can go to where you can price shop for drugs. we'll say that little price shop for prescriptions. Sounded bad there for a second. But ultimately what you do is you go into here and you can see, you type in your prescription and it will tell you the actual cost of that at the different locations. Again, what are some ways outside of insurance that employees can benefit and ultimately help reduce their costs out of pocket? Or the next one. This was one of my favorites because it's not really known. So some of you may know an individual who takes an extremely high cost prescription, $5,000, $10,000, whatever it may be, for more severe ailment, AIDS, sometimes MS. Yeah, and what also happens is you find that, I've tried the generics, I've tried this, I've tried all these things, but this is the only one that works for me, and it costs an arm and a leg, and there's nothing I can do about it if I want to be able to live a happy, healthy life. So what this is this is actually a nonprofit organization, and what they do ultimately is they help you fill out the paperwork to go directly to the pharmaceutical companies for low-income individuals to try to get the prescription either subsidized or paid for in full. So I always talked about, if you've got a $5,000 or $10,000 script, contact the pharmaceutical company, plead your case, tell them this is all that you can do, and they have actual programs set up for it. Well, this is the gateway to those programs. So, I figured it'd be something worth sharing because this is one of those things that more employees know. Now that we're talking about that high deductible, we've given them 3 different avenues from basic to middle of the road to really more severe low cost that they can do on their own to help save them some money.
Yeah, the biggest tool on this, especially the GoodRx, is mainly if you have the high deductible health plan. Because if you have a $10 copay, 25, 50, whatever, it's not really going to affect you. But the high deductible health plans just brings that more consumerism, especially saves you money, etc. And I've used it personally, and it's saved me quite a couple $100.
And part of what we're trying to teach employees through a process like this is what is the actual cost of a procedure, of a prescription. So when they say year over year, how come my health insurance costs are going up by 15%? And we talk about utilization. Then we explain to them the actual trend and how it works and why it works. And everyone's kind of part of this. Everyone's part of the picture of how can we try to get better utilization through some basic best practices.
And in the future, there are some tools out there now for health benefits. If you want to get an MRI and you live in Onondaga County, but you see, you pull it up as $1,000, but you're going to be able to compare it. If you drove to DeWitt, it might cost you $400. So that you're going to see a lot more of that in the Midwest. It's very common. If you ever read the book, The Company That Solved Healthcare, it's a great book out there that talks about a manufacturing company in Wisconsin that had self-insured, and they saved thousands of dollars by getting their employees involved. And it's a whole other story, and I could probably spend a whole day on it. But if you want to talk to me after, I'll tell you how it worked. Some healthcare facts, we just wanted to bring these up. Many health problems have to do with the lifestyle or the lifestyle choice that employees choose, which obviously increases costs. A couple of them, I can't read that slide, but $670 per year, unhealthy behaviors, mainly based on their lifestyle. Obesity accounts for about $400 of those costs. So we just got these from the Human Resource Management Society. Alcohol and drug abuse, you guys can see that, $193 billion per year. Tobacco use, billions of dollars. Well, not only Medicare, but comp, disability, and lost productivity. So, is there a cost to all this? Yeah, but it's wellness tied in with your health plans, your utilization, and bringing the employee educated and giving the options. Preventable illness, that's approximately 70% of the burden of illness, and that's just folks not getting checkups. We're going to talk briefly on when you're looking at health plans and ideas and looking at your utilization, how that piece is very important. Catching something early compared to when it's too late, affecting your renewals and increasing at the end of the year. Most of you probably seen a slide like this, but since 1999, you can see healthcare costs have gone up 196%. It's over 200 and something percent right now in 2014 through almost 15. And as you can see, salaries have only gone up about 50%. The challenge here is that middle part. When you get that 10% renewal or 20% renewal or whatever that is, as HR folks, you got to look at that and say, how are we gonna split that structure? We can't put more on the employee when they're making $8 an hour or $9 an hour. So it's a challenge out there that when you sit with your brokers, you can talk about different options and ideas in order to offset that cost, which would also include wellness. Impact on your medical insurance, I kind of just touched on some of this, but companies over 100 employees, your percentage of your renewal is based on the credibility, the percentage of your credibility of your account. If you're under 100, between 50 and 100, you can still get a health plan management report to see what it looks like, the book, see what the book is doing, but all of us can impact whether you're in a community rated pool, a mid-level pool, or an experienced pool, just based on, as a consumer of my health care, if I can do my things, try to stay healthy and all that, and making the right choices, I can affect that trend. And as a group or as an employer group, you can actually try to bend that curve of the increase.
And I think to Mark's point, that's one thing we want to get across is even if you're a company of 5, 10, 15 employees where maybe the claims don't directly affect your rates, I mean, we're all part of the solution here, whereas we all really need to focus on whatever may be, happier, healthier lifestyles, really becoming good consumers, because even though it doesn't directly affect your rates in that area, it directly affects the overall book, which is still at 10 to 12 to 15%. So the better we are about becoming good consumers of healthcare, I actually had an employer group say it like this, and it was very easy to understand in that they said, now if you were to go out and buy a car, would you just walk up and buy the car without haggling, price shopping, everything? And everyone in the room said, no, of course not, that's absurd. Well, then why are you doing it with your healthcare? And it's kind of like, that is why are people doing it with healthcare? Because some people don't know, they don't know their options. So that's a part of it.
And a challenge there too is having cost out there.
Quick question.
Yes.
If it's an employer of 50 or under, is that correct that it's like a community, the rates
Yeah.
are, is it called community?
2016, it'd be 100 and less.
Yeah.
Okay.
But right now, 50 and under is community rated, so you're in a pool of groups that size.
But the rates, to the point you were making, the rates aren't directly related to.
Yeah, they're filed with the
In
state.
that category.
Yeah, so
So that pool of claims, all those groups, let's just say in the network in Central New York, all the groups under 50, all those claims will be part of the reason your carrier will file with New York State. We need a 10% increase because our claims are at this point.
yeah.
Okay? And because of the bronze to platinum, it's a 9 through 12 for 2016. But it's going to be 100 less. But I think the biggest piece of this is healthy employees are happier, more productive when they can have a direct impact on their bottom line. And that's by choice, just like Dr. John said earlier. You can't just take a square peg and put it in a round hole. You got to give them some options and some ideas, and then let them take control of what they're going through and what they're dealing with. So evaluating health themes and trends, and I think we're touching on some of this, but what are the cost drivers? Are preventative services, are they being utilized? Are people getting to the doctors? Do they know about the generic drugs? How does that work, et cetera? If trends have been showing the same trend over year after year, with community rating, you won't see that at 50 or less this year. But if they're trending over, if you're over 100 and the trends are the same and you're not doing anything about it, it's just going to continue to increase and probably even higher than trend, right? Are they preventable or can they be reduced? What plans can be implemented? And can the outcomes be measured? The key, and I think we touched on some of this already, wellness plus consumerism, it's going to equal results on two sides of the world, utilization and healthcare for the employee as well.
And I think something important with this to note that is, in working with your broker, have a plan. Have an ultimate goal. What are you trying to accomplish? What are you trying to get to? Is it employee satisfaction? Is it reducing a certain trend that it is from that you're seeing year over year? Whatever it may be, work hand in hand with them to see what steps can we take. And little things such as preventative services, whether they're going or not, that actually can have a huge effect down the line because as Mark mentioned, as things continue to snowball, nobody checks, they get worse and worse every year. All of a sudden, somebody has cancer that they've had for 3 years because they haven't gone to the doctor.
But that's also, those are free, and so that's important to communicate to employees.
Perfect.
They're not getting a copay on that visit.
That's right. It's educating the employees. That's exactly right.
That's
I think you jumped a slide or two here.
Yeah.
But the bottom line is, you your healthcare costs, as HR professionals, controllers, finance folks, you kind of know what your health costs are. If you're seeing your claims, you know what's going on. If you're in a community rated, you kind of hear your broker should be letting you know what the trend is and what's, by June or July, what they're looking at as far as what the carrier's filing with the state. But this is the part you don't see, is that 70% of those costs are, health related, the productivity you're losing, people, presenteeism, people are at work but they're sick, they're agitated, they're not working well, if you're on a manufacturing line or whatever, engineering, it doesn't matter. And then absenteeism, if you're sick, depressed, anxiety, etc. That's the part we don't see of the cost until we'll really nail it down.
And as some of you know, even with absenteeism, if somebody's out, there's 3 people in HR, somebody's out, the other 2 individuals have a higher workload, have a higher stress level. So it's a chain reaction ultimately when people are absent.
Yeah, you don't really see those costs. So, what else does your broker fit in? Developing the health plan options around our goal. Again, we talked about the cost drivers. Can they be reduced, or what's some ideas? Can they be reduced through education? That's a big thing. Employees, the more companies I sit with, education is a challenge. If you're want to do an HSA or an HRA, folks don't know how it works. I was just at the HSA meeting earlier, and it was a packed room, right? Because I think more and more people have to go high deductible health plan, and you need some kind of a solution. So, using your broker to educate your employees is a big thing. And then the plans must be developed on the needs of the employees, so they have a chance. It's not a one-size-fits-all. I think we touched on that. Give employees options, whether it's multiple high deductible plans, whether it's a high, low, middle plan, that type of thing. Again, I can spend days on that stuff as well, but it's based on your employees. I like to say that you know the employees, but a lot of times we don't know the employees, right? We think we know the employees. I had groups tell me they don't know technology, they don't know how to just say, don't even roll it out. So if they can save 30% on they can save 30% of paying taxes, you gotta let them know about it. Give employees a choice and control, and that's a more effective way, like Dr. John said earlier. If they have choice and control, they're more apt to stick with it and become a more healthy group. Plan designs, I think I touched on that. Having a high, middle, low, I don't think I have any groups, any brokers in the room. You have multiple options. Mainly, a lot of people put a high deductible in there just for the affordability piece for the ACA requirement, which is fine. But at least it got people thinking about, I gotta give these guys options, because now an employee, whatever their needs are, I think I'm jumping ahead, but based on, younger folks that don't want to pay a lot of premium, but they want to have catastrophic insurance, they want to put pre-tax dollars aside, whatever, they can choose that high deductible health plan. Or somebody's sick, they might want to go to a co-pay plan or a middle plan or whatever your needs are. But your broker knows, that's probably the better way to go as a company. Do you want to answer?
No, I mean, really it's one of those things where we look at, this was just one strategy that we used. We wanted to give you another takeaway looking at different buy-up options, and we'll touch a little bit more on it in the next slide. But we're seeing it more and more, and we get a lot of feedback from employees as well as employers alike. The employees tend to feel comfortable talking to us after the meetings, and the employers tell us what they hear, and we actually get a good mix of both by the time we're done as to how things actually work. And you wouldn't believe, you may believe, the amount of employees that once you roll out kind of a 3-plan, you guys can choose whatever you'd like, but if you want the more expensive plan, you have to pay more for it. If you want the more high deductible route, depending on the deductible, it may not be as expensive. But the thought of the employer saying, we don't know your medical needs. You know your medical needs. Maybe, guess what, you're going to pay more because you're just comfortable with the copay. Or you want to pay less because you don't go to the doctor ever. Go for your preventative, but you don't go to the doctor outside of that. We've actually had employees come up to us and come to the employer and say, thank you for thinking of this. And it's as simple as that. That change in morale all of a sudden, whereas the normal meetings around health insurance, let's face it, is I'm going to lose benefits and I'm going to have to pay more. And I don't really want to be here. That's what a lot of you see it from the employees. After you roll out a total shift like this, where it's about you. You see the smiles, you see the thank yous, and that's what we're trying to help teach, and that's part of our message.
So I think Pat just hit on a bunch of this, but as individuals become older, prescription drugs go higher, you might want to go with a copay plan, or you might want to go higher deductible based on your out-of-pocket next. The point of this slide is individuals need to make their own decision based, sit with maybe your broker partner or the carrier partner and just talk about what your needs are. And if you have multiple options out there, and the community rated plans now, there is no limit to how many plans you can offer anymore. There used to
That's a
be.
question, because we
Yeah.
offer 2 high deductible and
Yeah, so you can offer 3, 4, whatever, as long as someone goes in it, there's no limit to that. There used to be.
To go along with this same thought process of choice, what some employers are doing is they're saying, we've always had 2 high deductibles, we want to, maybe roll out a copay or something like that. And what they've said is, but we can't really take the increase in cost from the employer standpoint because we can't pay 70% more. And they're going to a flat down amount. And they're saying, guess what, every month we're going to give you $300 or whatever the number is, and you go spend it however you want. You can buy this plan, this plan, this plan, this plan. It's totally up to you. It's your choice, but here's what we can contribute. So that way, from an employer standpoint, it doesn't matter to you which plan they pick the plan that's best for you.
Okay, I just got the sign, so let's rush through 5 minutes. The big piece of this slide here, Pat already talked on the contribution piece, but managing high-cost claimants, if you're experience rated, that's some of the biggest issues out there because I just told you the technology and the RX, especially drugs. But catching things early, encourage the preventative visits. If it's a reoccurring high-cost claimant, make sure case management's involved, and your broker can help you with that as well. And then employee education is probably, if I can underline that 100 times, that's the biggest piece. Educating folks, again, we talked of some of this stuff, the pricing transparency, knowing how much things cost in the future. Like I said, in the Midwest, around here in Central New York, it's going to be a big thing where when you go to buy big screen TV, you probably go to Sears, Walmart, Raylands, etc., right? Pretty soon you'll be able to see all those expenses out there. There's some out there now, some hospitals are putting it out there, but we do have consumerism in there, especially with a high deductible plan. That's where that consumerism is going to really take off. Just some examples on a wellness piece, the shopping, we'll talk about that. HSA piece. Biggest thing, employees reduce the well-being of the health. Some companies that I work with, they have a vegetable truck come once a month in the summer, and they come in and at break, yeah, not the winter. They come in and people go out in their lunch hour or their break, and they can buy fresh fruits. And I thought that was a good idea. They also have a fruit of the month. They do.
If you think about the vegetable truck, you're spending 31.7% of your time at work. What about drive time back and forth? What about time to get ready from work? What about time to de-stress? When do I get to the grocery store? To actually be able to buy what I need to have a healthy meal. So the thought behind that is, well, let's just bring the healthy meal to them and they can buy it right there and take it home with them. Phenomenal idea.
So questions you can ask your broker. Number 1, how's my rate developed? If you're community rated, if you're 50 to 100 at this point, how does it work? And then over 100, what's that credibility factor? That's probably the first place to start, just to see what kind of impact you can have. If you are a larger group and you have large claims ongoing, know more about them. And your broker can tell you all this. What specific cost drivers in the population of employees? How would a multi-plan approach, if you only have one plan, what would that multiple approach look like? And some of you prior to major decisions anyway for January, but going forward in the future, you want to start thinking of outside the box. Because costs are not going down, I can promise you that. Zero claims, that's just a slide. If you have $0 to $250 preventable services on your utilization form that's proves over 100, and say that's 30%, that means 30% of folks aren't even getting a checkup. So if they're not getting a checkup, again, an education piece, it costs nothing. Catch something early instead of a large claim that's over 100 grand and ongoing year after year. That's what kills a lot of groups, because it's too late. What's the best way to, percentage of generic usage, that's something you can find also, even in the 50 to 100 area. So if folks are asking for generics, get them to start asking for it, if they can, obviously. And then lastly, ask your broker, what's the best way to get started in a wellness program, and how do we kick one off? And again, that's a whole day's meeting, but with your broker, it should take you an hour or two. But if you get the buy-in of up above, like Dr. John said, that's the key, and it will filter through. And then this is the two-edged sword I was talking about, twofold impact on the bottom line. Not only will it impact you through the presenteeism and production. It also show up through the utilization of the renewal the next year, the year after, the year after. So it's an ongoing thing that you can hit both things at once and give the consumerism and control back to your employee. And then this last quote, if you think consumer good health is expensive and time consuming, try illness. Lee Swanson. Any questions? I think we went over a couple minutes over, but we're going to be around. We got a booth out there. Come on over, ask questions or ideas, and we'll be glad to share them.
I just want to add a comment. For smaller employers, one of the booths down there is the Healthy Syracuse Initiative, and that's a volunteer organization focused on smaller employers who are not community rated, to where the community as a whole can take some action. And there's wellness programs and stuff through that that's designed for smaller employers where they don't have their own wellness
Oh,
group
great.
or whatever. So.
Good answer. Anything else?
Thank you guys.